really enjoyed like biology and science and the sort of concept of being able to utilize like knowledge to help people. And so I actually applied for medical school when I was a high school student. I was actually in one of these combined programs. So it was like an 8-year combined program. So I actually got into medical school as a senior in high school, really on the off chance that I was like, hey, maybe I want to be a doctor. My name's Joshua Diamond. I am the Associate Medical Director of the Penn Lung Transplant Program here at Penn Medicine. As an academic transplant pulmonologist, I have sort of multiple different roles. The primary one is my role as a clinician. So I see and evaluate patients who have advanced end-stage lung disease and assess them for candidacy for lung transplantation. And if they end up being listed and transplanted, me and my colleagues provide the care around the time of their transplant surgery and all of the management of their care afterwards. So in essence, I end up being their doctor for almost all of their problems for the rest of their lives. My time is split between seeing patients in the outpatient setting and a clinic setting, but I also have a significant amount of inpatient time, and I take care of transplant patients wherever they are in the hospital. So ILD is probably the biggest driver of lung transplantation, not just here at Penn, not just in the United States, but worldwide. So I see patients who have interstitial lung disease who are coming to me for management of their disease, as well as patients with those same diseases who are coming for assessment for candidacy for lung transplantation. At the beginning, when you get discharged after a lung transplant, you go home, you come in to see me on a weekly basis. It's not just me, it's me and a team that works with me. So I have a nurse practitioner partner and a nurse partner. And for the first several months, we're seeing you on a weekly basis. And then after that, we're seeing you every other week, every 3 weeks, every month, for at least a year after your transplant. And then for the rest of your life, I see you at least every 3 months. And we're checking up on everything. I'm making sure you're getting your immunosuppression measurements taken. You're making sure that we're dosing medications correctly. We're getting chest x-rays and pulmonary function tests and making sure the lung is working well. But we're also taking care of all of your other problems. They're not calling their primary care doctor, they're calling their transplant doctor. I am then hopefully helping them get set up with a dermatologist who can help them with their sort of specific issues. So I do that for the rest of their lives. And what I love when they get to that point in their time course, a lot of what we're doing isn't medical care, it's like social care. It's like a visit with a friend. Like, how have you been doing? What have you been doing for the last 3 months? Where have you gone on vacation? How are your kids? How are your grandchildren? How's your spouse, your partner? Like, what are you able to do now that you weren't able to do before your transplant? And how has that made your quality of life better? And like, that's what I get enjoyment out of and why I continue to want to do this.